us today. I said previously that there isn't a community, a business, or a family that hasn't felt the economic impacts of COVID-19, and our state government is no different. So yesterday we announced an additional $250 million in spending cut across state agencies for this fiscal year. This is a proactive step that will put our state in a stronger position to weather revenue impacts from the COVID-19 pandemic, while also ensuring that critical services remain accessible for Wisconsinites. While I'm still hopeful that the federal government will adopt further proposals to stabilize funding for state and local services in the face of continued inaction and uncertainty, the unfortunate reality is that we must take these steps to do everything we can to stabilize the state's budget and ensure that our economy can recover. As local school officials continue to weigh these difficult decisions, we announced today that 155 local education agencies are eligible to apply for the $46.6 million provided to Wisconsin through the governor's Emergency Education Relief Fund established under the CARES Act. This funding will go to the K-12 schools that are most significantly impacted by COVID-19 based on economic disadvantage, access to technology for kids, access to the internet, and student scores on the English Language Arts Assessment. These important funds will help support students, educators, and parents who are navigating this uncertainty by ensuring schools across Wisconsin have the additional resources they need as they make decisions about how students will learn in the upcoming school year and beyond. Folks, this is a critical time for our state, and we need to rise to the challenge before us and meet it with empathy, kindness, and respect for our neighbors and our communities. We must remember where the real fight is. It's not with each other, but against this virus. We will continue to listen to the science and the public health experts to determine the best course for our state. And as I said, the work we do right now will set the stage for later. I know folks have asked about a statewide mask order, and that's something we're looking at. But the bottom line is that every single person can do their part right now, today. The continued trend this week of record day increases in positive cases is dangerous, unsustainable, and dilutes the months of effort all of you put into staying home to help protect the health and safety of our communities. So I want to thank the many local and national businesses that have taken steps to keep customers and employees safe, like requiring masks, enforcing social distancing, and allowing employees to work from home whenever possible. But whether you're an employer, an essential worker, student, or consumer, it's on all of us to decide what the weeks and months ahead are going to look like in Wisconsin. And we cannot continue down the path we're on. Wisconsinites are resilient, and I know if we put the health and safety of our communities first, we can get Wisconsin back on track to bounce back stronger than ever. But we can't do it we can't do that if we aren't working together to flatten the curve and slow the spread of the virus. First and foremost, we need folks to wear a mask whenever you're out in public or around people outside your immediate household members. There's no conspiracy, folks. Wearing a mask, face mask, will help protect the people around you, including those at higher risk for severe illness and workers who frequently come into contact with others like nurses, grocers, and first responders. Secondly, continue to utilize alternative shopping options like curbside pickup, online ordering, and delivery whenever possible. Next, stay home if you feel sick or have been in contact with others, and contact your healthcare provider or find a community testing site to get tested. And finally, the safest thing you can do is stay home as much as you're able. And that doesn't mean stay home but host a backyard barbecue, play dates, or dinner parties, but stay home and keep your social circle as small as possible. We know that our safer at home efforts early on saved hundreds of lives and prevented countless hospitalizations. So let's double down on the practices we know we can help, that can help protect our neighbors, friends, and family from this deadly virus. And now I'll hand it over to Secretary Designee Andrea Palm for her COVID-19 update. Andrea?
Thank you, Governor. Good afternoon, everybody, and thanks for joining us again today. I want to start today with an update on our numbers. We've added 14,212 to our total number of negative tests, which brings our cumulative total to 778,842. And as of today, we have 45,899 total positive cases here in Wisconsin, which is an increase of 1,052 cases over yesterday. We are now at 878 deaths in the state of Wisconsin, which is an increase of 13 over yesterday. These numbers are at least in part a reflection of two patterns: a significant number of cases that reported attending gatherings like parties and bars and barbecues, and an increase in cases among young people. In fact, in all confirmed cases within the past month here in Wisconsin, fully 1/3 of them have been people in their 20s. Please, the safest thing to do, as the governor said, is to stay at home, limit your interactions, and wear a mask or cloth face covering when you go out. I know it can be difficult to hear these numbers. We know that each case is a person struggling with the stress of this diagnosis and what that means for their family and their health. We know that each of our 878 deaths is a person who is being remembered and missed by family and friends who feel the heavy weight of their loss. And we know that each of us is dealing with different stressors connected to this pandemic: health and financial concerns, worries related to juggling kids while working remotely, or by virtue of being an essential or public-facing employee, anxieties about the risk of coming into contact with someone with COVID-19. These stressors can certainly compound each other, and no one is immune to the stress and anxiety this epidemic has brought. The increase in calls to 211 Wisconsin asking for help with behavioral health concerns tells us that people are struggling. In fact, the need for assistance with mental health and addiction issues rank third among the reasons for calling 211, behind only COVID-19 and housing concerns. And since the start of the pandemic, we've seen an increase in suspected opioid overdoses by 117% from the same time frame last year. We need you to know that help is available and that it's okay to ask. Calling 211 is one of the ways to connect with sources of support. And the Wisconsin Addiction Recovery Hotline, which you can access through 211, is now available to make follow-up with callers to make sure that they have made the connections necessary to get the services they need. DHS is grateful to be able to provide funding to enable this follow-up program. We also continue to partner with local and tribal health departments and community recovery organizations through our Narcan Direct program to provide virtual training as well as naloxone free of charge, and we have a statewide standing order to make naloxone available without a prescription at our participating pharmacies. In addition to these programs and initiatives, as you know, we launched Resilient Wisconsin in April to provide strategies for dealing with stress and for seeking support to recover from adversity during the COVID-19 pandemic and beyond. We continue to update resilient.wisconsin.gov with more resources, including links and numbers for helplines and virtual support meetings. Taking care of your mental and emotional well-being is part of taking care of your overall health and safety. And we must remember that and continue to do our part to both stop the spread of COVID-19 and to take care of ourselves and each other.